Well, it looks like we're going to be a little intimate today. So there are going to be points throughout the session where you can certainly take yourself off mute so we can have a good discussion. Thank you for joining us today. We know we're coming in right after lunch for some folks, maybe around that mid-afternoon time where we need some coffee to get us up and running. So we'll try to keep this as engaging as possible. Be sure to have your smartphone handy. We do have a couple of activities where you could use your phone. And also, let's try to have fun with this. We're going to share with you what we call an audience first approach to developing culturally competent health materials. And I think, whether you consider the US a melting pot, a salad, as some folks have referred to it, I think we can all agree that there is quite a number of cultures that are represented in the US, and that it's important for us to acknowledge that and to take that into consideration when we're developing materials. And Charles, no problem. You can type away. We'll pay attention to the chat as well. And so we want to make sure that we keep some of these things in mind. And so before we dive in, we can go ahead and have introductions. Next slide. My name is Cassandra Oshinnaiye, and I'm a director with ICF Next Multicultural Communications Practice. My pronouns are she, her, ella. I've been working in multicultural audience engagement for about over 15 years. It doesn't feel that way, but I guess it has. I'm a first generation Dominican American. I'm also a first generation college graduate. I am Nigerian by marriage. I always get the question, well, where's your last name from? So I figured I'd share that tidbit with you. I am a mother of three. I have two grown boys that are in college, and I have one teen girl that is driving me bananas, but we are enjoying every minute of it. Imani, do you want to go?
Yeah, and so my name is Imani Cabassa, and I'm a communication specialist here at ICF Next in the Multicultural Communications Practice. My pronouns are she, her, and hers. I have over 5 years of experience in public health, health literacy, and health education and promotion. I'm a first generation college graduate working towards my PhD at Howard University, and I'm a mother of one who is one. Yes.
And we just wanted to give you this level of introduction because I think you'll notice as we talk about audience and the importance of knowing who your audience is, what are some of the data points that make sense for you to know as you're considering some of your messages and materials. A little bit about ICF, and I promise this isn't a sales pitch or anything like that. ICF is a global consulting firm. We sort of think of ourselves as a mix between a creative agency and a consultancy firm because we do both. We have, as a multicultural communications practice, our goal really is to connect our clients with their intended audiences in an authentic way. We have capabilities in formative research, message development, and campaigns, which you'll hear us talk a little bit more later on. Next slide. And then today, what we will cover are one, the importance of knowing your audience as you're considering creating any health related materials, the role of community partners, which we'll touch a little bit on that, as well as what are the things you need to consider when you're creating your materials. We'll leave some time for Q&A at the end, but since we have such an intimate group, I think that we will probably be able to answer questions as we go. So, feel free to pop your questions in there in the chat, and either Imani and I or I will answer them. Next slide. Now, throughout the session, we're going to be using examples from a current project that we're working with the Morehouse School of Medicine, which is as part of their National COVID-19 Resiliency Network. This is an agreement between HHS, Office of Minority Health, and Morehouse. We were contracted to conduct some research to help with engaging of partners and developing messaging and culturally appropriate materials for the dissemination of information regarding COVID-19 and getting vaccinated. The audiences, we had about 10 audiences that we are currently reaching out to, and there's a list there of all those we are engaging. And so first things first, right? So when we are thinking about developing materials or any type of message, health message, you want to make sure that you really start with knowing who it is you want to reach, why it is you want to reach them, and what it is you want them to do. And it's important that you're clear on that from the beginning, because this is how you will determine how effective your efforts are. Did you really reach the people you wanted to in the way you wanted to? And did they do what you wanted them to do? And so when looking at the Morehouse project that we've worked on, we knew that we wanted to reach those audiences that we shared with you earlier. We wanted to reach them because they were disproportionately affected by COVID-19. And we also knew that the rates of vaccination were low in those communities. And so we wanted to make sure they got vaccinated. And at the end of the day, that was our call to action. Next slide. And so this brings us to a very, very, very important first step, which is really getting to know your audience. Who is your audience? And I'll turn it over to Imani for this one.
Thanks, Cassandra. So we are going to start with a little activity, and that is answering this question, what is culture? So if you have a smartphone, you can go ahead and scan this QR code. The link is also going to be dropped in the chat to a Menti question, and we are going to give everyone about 30 to 45 seconds to enter that and participate. And while you guys are answering that within Menti, I'm going to pull up my screen so we can see the results coming in. You guys can see my screen, right? Perfect. And so as you're typing in this answer for what is culture, once you submit your results, they should be like flying in on Menti. Behavior, traditions, beliefs. Any more people want to answer? If not, we can go ahead and keep on going. Awesome. Observe interactions. I like that. So I'm going to go ahead and switch back on over to my PowerPoint. Thank you for participating. And so, yeah, what is culture? Sorry about that. You all provided some really great answers. And I think that one thing to like get us going when we think about culture is many different things. There are 3,800 cultures within the US. And so because there are so many different cultures, there are so many different meanings to those cultures. And when we were going through and trying to create this approach, we started thinking about all of the definitions of culture, and I'm going to read a few. So one definition that we found believes that culture is a cumulative deposited knowledge of experience, beliefs, and values, attitudes, and meanings that are acquired by a group of people. Another discusses how culture is a collective programming that distinguishes the members of one group of people from another. And then finally, a definition showed that culture is a way of life for some people, and a group of people that have the same behaviors, beliefs, values, and symbols that they generally accept without thinking about them day to day. And so all of those definitions of culture are true, but one extremely important definition of culture to us is that culture is communication and communication is culture. I do want to emphasize really fast that when we say culture is communication and communication is culture, we want to be clear that language is not culture, but language is a part of culture. And we take that into consideration when we are creating our materials. So in an audience first approach, we need to carefully consider a number of factors, some which are listed here, as you can see, are things that we consider when we are creating materials for diverse cultures. We include things like gender roles, communication styles, attitudes towards conflict and communication, language preference, cuisine and dietary habits. All of these things allow us to capture an audience first approach. This information combined with demographic information and other psychographic information provides a better picture of your audience. And it's why we feel it's important to ask a lot of questions. To give an example, we can't just say African American. We want to know what age, what gender, what education level you want your materials to reach, what socioeconomic level, where are they located. African Americans in Tennessee might have a different experience than African Americans in Michigan. All of these things matter for us to develop any effort. And because we believe audiences should be included and see themselves and feel respected, we have to be specific. So we don't want to assume that everyone here within this workshop knows what demographic and psychographic information is. So when we talk about demographic data, we mean information about groups of people according to certain attributes such as race, gender, place of residence, and socioeconomic factors like occupation, family status, or income. And for us, psychographic data means looking around at groups of people based on their attitudes or beliefs, and it's sometimes referred to as lifestyles. You can drop this in the chat, but where do you all think that we might find demographic or psychographic information? Anyone? Not sure? That's okay. We're here to talk about it. One thing we will talk about where you can find this information as part of our next slide. Oh yeah, the census is a great place to find, especially demographic information. We'll talk about this some more within our next slide, but while I am here, I do want to point out one really important thing that drives multicultural audience focused engagement. We consider the audience at the point of time, and so the issue that is taking place that we're trying to address in the media that is around, we keep in mind that not all issues are the same. So it's important to understand how your audience experiences that particular issue. And some questions you should explore when you are thinking about creative materials is, are there historical traumas related to this issue? What are the biggest challenges for barriers for the audience as it relates to the issue? And who is the messenger, and is this the right messenger? And is this the audience that should be addressing this issue? So when we were working on our intern project, one way that we considered how the COVID issue affected like African Americans, for example, we know that there's historical trust within the African American community and the government. And so we had to make sure that some of the deliverers of our messengers were people in the community, African American community, like their clergy, their pastors or reverends, or their local pharmacists, because those were people that our audience could relate to the most. And so I'm going to pass it back to Cassandra, who's going to ask another question.
Okay, so in the spirit of how do we get to know our audience? Because, getting to know your audience is important. And yes, you can look up census data and you can look up, Wilbert mentioned the Chamber of Commerce. These are all great. But where else would we go, or what would we do? What else could we do to really get to know our audience besides looking at these areas? Any thoughts? If you needed to learn about how, I don't know, what Latina women thought about heart disease, focus groups. Yes, that's a great example. Focus groups, definitely. Any other thoughts? So we have focus groups. We may, are you doing the Menti?
Yeah, I didn't know if you had mentioned if you wanted me to start it. It's fine.
Sorry, guys. Yes, existing research, engaging the community group tools, absolutely. Community organizations, always. And we'll talk a little bit more about community organizations later on as well. Local agencies and churches. Yep, you got that.
Yeah.
Ask the people who you're wanting to reach, right? We have a section on that as well. Very good. These are all great. So in the nutshell, what we're talking about is formative research, right? So formative research really helps us to understand the characteristics and the interests of our audiences. And it's important for us to keep all that in mind, as we talked a little bit before, when we're designing our materials. And as part of formative research, which some of you did point out in the chat, you have focus groups, right? And you also have what we call in-depth interviews. These are more of like one-on-one interviews. You also have what we call the literature review and environmental scan. This is when you look around what's happening out and around with regards to that particular issue. What has been written? What are people saying about the issue? And that's in your messages and media content and materials audit. And so we do this, and at the same time, you don't just do it once and you kind of are done with it, but you also just keep on going, getting more insights as you're talking to other people. But at the same time, while you're developing materials, time can go by, right? So you can start engaging and wanting to do materials, let's say in January, and you're done with your research and you're done with, looking things up in, let's say, March. Well, that's 3 months, and a lot can happen in 3 months. And so that ongoing collection of insights is really important. I'll give you an example. For the project that we mentioned for Morehouse, we had, as we mentioned, about 10 different audiences. We had about 81 in-depth interviews, 95 materials that were part of our audit. We found 283 messages around COVID. So all this is COVID-19 related and COVID-19 vaccine related. We had about 131 individuals that were part of focus groups. And so depending on your budget, depending on what you're trying to do, will depend how extensive this research period will be for you and the extent to which you involve large groups of people. Sometimes as you're gathering research or you're discussing the topic with folks who know your audience, you may realize that you may need to segment your audience or create subgroups from within your audience to be even more effective with whatever material or whatever message you're wanting to put forth. Or you discover that there is a particular subgroup that is much more effective than another, or maybe your budget is just too small and you only can focus on a very small segment. Or perhaps you have a partner that's a great partner that, for example, only works with African-American women. And so you may need to do these smaller groups, which Imani will go more into detail on what audience segmentation is.
Thanks, Cassandra. So, audience segmentation, we have done this a lot within our intern project, but segmenting audiences, like Cassandra mentioned, is the act of like dividing people into subgroups based on various factors. And these factors can include their communication behaviors, their demographics, among other things. Audience segmentation and multicultural communications is important because there are many subgroups and cultures within each race or ethnicity or culture. For example, all Black people in the US are not the same. There are African Americans, there are Afro-Latinos, there are Caribbean Americans, and those are all Black people. Generally speaking, although there is often some shared identity among a particular race, the vast diversity ushers in unique values, characteristics, and needs within the subgroup. So for example, within our intern project, we had an African-American general population, and we also had a subgroup that we segmented, and that is our African-American young adults with intellectual and developmental disabilities. And within this audience, we described African-American young adults with intellectual and developmental disabilities within our formative research process as adults who were ages 18 to 24 years old. They had to self-identify as African Americans with intellectual or developmental disabilities and be located within Los Angeles County, California, and surrounding areas, and the states of Georgia and Louisiana. And through our research, we found that people with intellectual and developmental disabilities are 2.5 times more likely to be diagnosed with COVID than the general US population, and that they rely heavily on their healthcare or support providers, their family and friends, and others for COVID-19 information. So pictured here, we have 2 of our social media graphics for our campaign with our African-American young adults with IDD. Pictured in the graphics, you see our young African-American young adult with IDD, as well as their support person, with a campaign message that says the COVID-19 vaccine is good for your health. Not pictured here is our call to action, but the call to action says to, talk to your family member, healthcare provider, or teacher and find out where you can get the vaccine. And that's really important because it looks at, it acknowledges that, this audience in particular needs help to find the vaccine and calls upon their trusted sources of information to help them with that so that they are able to get the vaccine. And I am going to pass it over to Cassandra, who's going to talk about our Spanish-speaking migrant worker community.
So another one of our audiences, so we did have Hispanic Latino general population as one of our audiences. And then within that population, we also focused on Spanish-speaking migrant worker community. Similar to what Imani presented with the last audience, we had to segment even further, right? So we went men and women, adults ages 18 and older, primarily Spanish speakers. And then in this particular case, we focused on El Paso, Texas, and the surrounding area. Some of that was led by the fact that we had a very strong partner in that area. And so we wanted to make sure that we leveraged that partner and what they were able to assist us with. Migrant workers in particular were of interest because although we know Hispanic, like the African-American population have been disproportionately affected, weren't getting vaccinated. With this particular audience, we also know that many of them were hesitant in even getting any type of health care for fear of deportation, because they weren't necessarily very familiar with the US health system. Many rely on community health workers for information. And so the fact that they work in very close quarters, and in some cases may live in very close quarters, made them more likely to also spread COVID-19. And so we wanted to make sure that we had relevant information made in language, keeping in mind the things that were important to this particular audience. We know from the research we did that the Hispanic Latino population, family was a big driving force in getting vaccinated, right? So being able to be with family, support family was important. For this particular audience, this segment of the larger audience, dependability on the worker is huge for the family because, because of them, the family is able to move forward. And so kind of pulling in on that piece of motivation for this particular audience was key for us. In the call to action, we say to go to the website for information, but to also ask your healthcare worker, your community healthcare worker for more information as well. One thing that we also wanted to acknowledge is the role that women play within this particular community as also being part of the migrant workers. They too are in the fields. They too are working alongside the men as well, which is sometimes something that folks don't often think about. Turn it over to Imani. You're on mute.
Of course I am. So we're going to do another activity. The national organization created a campaign to bring awareness to the public on the benefits of walking to control diabetes in patients. They would like to engage more multicultural communities to take on walking as part of controlling their diabetes. As part of their strategy, they've decided they wanted us to help create materials. What should we do first? Julie is going to pop a poll question in, and you guys should see that shortly, but we're going to answer what we should do first.
One moment, you guys, it's coming.
And it looks like we have majority of people have participated. Oh, that's everybody. So Julie, if you could show the results. And you guys are paying attention. The correct answer is to be clear on who your audience is. We multicultural communities, that's such a big term. And so who are we actually trying to make this material for? Like, who matters in this national organization campaign? The next question we have for you all is, how do we determine who our first audience should be? So it's another poll coming for you. And we have 100% participation. So Julie, you can go ahead and show the results. And again, correct answer was to understand who has the high rate of diabetes or who's most affected by diabetes. So Thank you all for participating and paying attention. But yeah, it is definitely important to understand who's most impacted by diabetes and what that is doing to this audience so that we can figure out the best way to create this message. So I'm going to pass this back to Cassandra.
Okay, before we move on, you can go ahead to the next slide.
Mhm.
Before we move on, I'll take a pause here in case anyone has any questions with what we've discussed so far in terms of getting to know your audience, research, culture, segmentation. You can either go ahead and put it in the chat, or if you'd like, you can unmute. And that way folks don't get too tired of just hearing our voices. We welcome others. No questions? Okay. All right, well then we will continue. I almost muted myself, sorry. So one of the things that our group really believes in is this phrase of nothing about us without us. And what this means is including the audience in the creation of whatever material or initiative you are creating is key. It is important. I will tell you that as we were working with the Morehouse Project, and every time we did focus groups, one of the things that the participants always said was, thank you for including us in the conversation. And I think that's important because oftentimes when we're busy kind of saying, oh, I want to get this material out, I want to get this information out, we're more concerned with the information and getting the information out versus truly understanding what it is that particular audience needs, and what it is and how it is that this particular issue affects them, and whether or not they can do anything about it, right? We assume that everyone can go to the doctor and get the vaccine, or we assume and everyone can just, drive to the nearest pharmacy and get whatever, health thing we want them to get. And so it's important that we do have that viewpoint as part of our process. And so next slide. One key, and I think someone mentioned asking the people going into the population to get this information, and you're absolutely correct. And one way of doing that, we mentioned focus groups. Another way of that is engaging community partners, and these are community organizations. Since we have a small group, I can certainly ask, when you think about health, right, what are some likely community partners you would think of that you would consider to help you in either disseminating information or creating health information? You can put that in the chat. I'm curious to hear. Yep. Churches, yep.
Those federally qualified health centers are really good as well, especially when you're trying to reach like American Indian, Alaska Native audiences, those are in tribal audiences. Those really play a big role.
Schools, local ethnic agencies. Jennifer, can you give an example of one?
Sure. We use the American Indian Health Centers.
Mhm.
We use the LSMA, Latino Student Medical Association. We use the Black Medical Association chapters as well.
Gotcha. Yep. Schools and colleges.
Fraternal organizations is really good.
Oh, that's a very good one, Johnny. The first and second generation healthcare providers within the same target community. Do you want to share a little bit about, for folks who may not be familiar with first gen and second gen, do you want to share your thoughts there? And it's okay if you don't want to. You can say, no, I pass. That's fine too.
Might be typing it in the chat too, so.
Oh, true. Okay. All right. Well, these are all great examples. Thank you, everyone. Schools and college. Oh, there's a new message. I'm sorry. Yep. So yes, so these are all great examples, and community partners, I think we all agree are important because they already know the community, right? They know what works, what doesn't. They are already involved in supporting or organizing the community around the issue you may have, maybe wanting to address. They are often organizations, their members are often also part of the community, which can help with building trust, and can also help to ensure that your materials are more authentic and resonate better. They can also help with building enthusiasm and interest around whatever issue or topic you're wanting to reach the community in. And I think I mentioned a couple of examples, but there are many different ways that you can engage community partners. You can leverage them to help you with the formative research. Yeah, they can be part of your process in recruiting focus group participants, which is some of what we did with our INSERN project partners. They can also potentially be part of your in-depth interviews, depending on what it is you're looking for and whose viewpoints you're looking for. They can serve in that capacity. They can also be really helpful in testing your materials. So, you've gathered your insights and you've, created whatever material, they can be a great source to go to and ask, do you think this will work in the community? Or even you can invite them to collaborate with you in actually writing the content, depending on what it is, of course. There are also potential for helping with disseminating materials, which is also key. One of the things that we talk a lot about and believe in our group is that sometimes the messenger is more important than the actual message, and who it's coming from often can make or break whatever it is you're creating. And so a community partner can be that messenger that is trusted by the community, and the community is more open to receiving it from them versus from your organization if you're representing an organization. Next slide. And of course, as you're considering working with partners, there are definitely things we should consider, and we often do, is one of them is the capacity of that organization. If you're asking them to be part of focus groups or helping you recruit with focus groups, do they have the resources and the staff to help you do that? Do they have the funding to help you? Our group really believes that it's important when you can to offer an incentive to the organizations, whether it's a funding source, or is there anything that they need that perhaps your organization can provide? For example, they may be in need of social media content and have no idea how to do that, and maybe your organization has a really strong social media presence. Perhaps you can help train a couple of their staff members to do that while they help you in gathering information on the audience you're trying to reach. And so there are ways for you to be creative there and find ways to work together, remembering always that it's a two-way street, right? You're trying to really establish and create a win-win situation where you get what you need, but they also get something in return as well. It needs to be a mutually beneficial relationship and one that's definitely built on trust. We know that our communities can be either too trusting and sometimes not trusting at all, based on experiences, historical experiences. And so trust is important. Having open communication, transparent communication, having them be part of some of those decisions that could potentially affect the communities that they serve. It's also important to take a look at. And at the core, I think of everything, really, the focus should be on what do you each do best for the community? What do you bring to the table that's important and good for the community? What do they bring to the table? And then together you make a stronger initiative and a stronger product for the community. Next slide. So this is an example of some of the organizations that we worked with for the INSERN project that we've been referencing. I think you'll notice a lot of these organizations are national in scope with local entities, which is also a great way to get messages across quickly. And that is partnering with, more national organization that does have the hands and what do they call it, the boots on the ground while you're trying to get your information out. We also looked for organizations. The INSERN had organizations that were also very much trusted in the community as well, which really also helped our efforts as well. Okay, we're on to our next activity. So the National Organization's Awareness Campaign on the benefits of walking to lower diabetes rates in the US, based on the research that's been conducted, they found that they wanted to work or reach African-American females between ages 45 to 64. They wanted, and the reason they're reaching out to this particular audience is because according to the research and the insights that they've gathered, they're the most interested in controlling diabetes, but just don't know how. We already know that African Americans in general have a high rate, right? Now we further segmented to African American women. They're most interested in controlling diabetes. They just don't know how. And we want them to walk at least 30 minutes a day. And so we are ready to start creating our materials or thinking about our materials and our messages. What partner would you engage for this and why? Who might serve as a good partner? And you can put this in the chat, or if you want to unmute, you can also do that. Yes, the National Association of Community Health Workers. Yep, very good. They are a very good partner for that. Any others that come to mind? I hear someone maybe wanting to unmute, maybe, perhaps. No? Local churches. And Shanika, particularly, is there a particular group within the local churches that you're thinking of?
Sorry, I was on mute. What I was thinking is, and probably why I said local church is like I can't remember what the institute is, but they have like a kidney Sundays where they bring into like the toolkit to have like pastors and church members kind of review the importance of like kidney health. So that's what I was kind of thinking of, like if they had maybe like a toolkit or something they could take to the church, and then the church members who are the trusted voices of the community could just present why it's important to engage in that.
Very good. Yeah, no, that makes complete sense. The sororities are a good one. Thank you, Charles. I think, Jennifer, you mentioned the intergenerational walking clubs. Yes, absolutely. And making it a family affair. That's a good one. That's a very good one too. The church wellness ministries. I had also on my notes the women's ministry within the churches would make a very good sense. Silver sneakers, absolutely, Sherry. And the other one that I also thought about, and you mentioned silver sneakers, I thought the AARP local chapters, right? They also have a number of health initiatives as well. These are all very good. But, at the end of the day, just really the local YMCA, yep. You know, at the end of the day, this is an opportunity for you to also be creative. But remember that you want to let your audience insights guide you towards what would make a great messenger and who would make a great partner. And so as you're sort of thinking about, you do your research and you're doing your focus groups, a good question to ask is, who would you trust to bring you this information? That's an easy question that you can always ask. Yeah.
Sorry. What would it be thinking outside the box? Like, I've always thought meeting people where they are. So if it's in a very close community, maybe like a local grocer, local deli, a person that probably don't often talk about those topics, but have that information on it ready and can direct people to individuals like professionals outside, like almost like a situation where you give them small information and then they could just redirect the person to more intense conversations with someone that may have that information. But that first contact is your local barbershop or local store.
Yeah.
Absolutely.
Yeah, barbershops and local grocery baggers and cashiers are like very important people to be disseminators of messages and materials. So those are great suggestions.
Yeah, and we actually have had campaigns where we've used barbershops and we've used nail salons and hairdressers to also be part of the dissemination of information. So absolutely, and definitely that is an outside the box, creative thinking. You know, we want to put it in places where people won't think it's there, but it is in a situation where they might be making a decision that could be part of the issue that you're presenting, right? So grocery stores make sense because, you know, if you're doing a diabetes program, if you're doing something that has to do with health, a lot of the decision making on what you eat and what you're purchasing for your health happens there. And so that's also a great way to look at it as well.
I just wanted to share that our students actually go out to bars to do HIV training at night because we have the highest Black males having sex with Black male in Michigan, in the greater Detroit area. So that's what we do there. We also do HIV training in barbershops.
That's great. And where are you? You said
in
Michigan?
Detroit. I'm at Wayne State University School of Medicine.
Okay, wonderful. That's a great idea. And to your point, I think both of you, I think Jamil, you were the one who was speaking earlier, and the person who just spoke, you know, meeting people where they're at. I mean, that's really what it comes down to. And you're absolutely right. Whenever we can do that, that is extremely effective. May not always be the easiest, right? It may not always be the most cost effective sometimes, depending, you know, on what it is, but it is the best way to move forward. Great. Okay, so next slide. And before I move forward, any questions regarding partners and partnerships and coming up with partners? Or anything someone wants to share? We've had two already, but if there's any additional examples folks want to share. Okay. All right, so we've learned about our audience. We're sure on who they are. We know why we want to reach them. We know what we want them to do. We know their interests. We know how they feel. We know where they consume the information and who they trust. And now we are ready to develop our materials. And so, next slide. in our audience first approach, we let our audience insights guide the development of key messages and materials. And this is important for us to emphasize because, again, sometimes we get really wrapped up in the message we're trying to provide and the information we want to give, that becomes sort of the guiding force versus really allowing your audience insights to guide the development of your key messages and how you're going to deliver those messages. And so using this audience first approach really ensures that your materials are guided by the audience and are focused on the audience, that those messages and materials resonate with the audience because you're using their point of view, their experiences, their journey, their path along this issue as your North Star, as your guiding light. And they are also more likely to be more culturally relevant, which then will make folks more motivated to follow whatever action you're wanting them to create, because now they see themselves in whatever it is you're developing. They feel seen, they feel heard, and are more likely to embrace, the message that you're providing. Next slide. And so when it comes to language, you want to use the language that your audience prefers, right? So this is where you will get that insight, obviously, from your research. So of course, the best practice is always to develop your materials from scratch, right? If you have the opportunity, you have the budget, you have the time, you want to develop your materials based on that particular audience that you are reaching out to. But we know that sometimes that can't happen. And sometimes you have a piece of a fact sheet, for example, that you just want to get into the hands of, let's say, a Spanish speaking population. And I take Spanish speaking as an example because it's the one that I specifically work directly with. So, you want to get to a Spanish speaking population and you want to do that quickly because you cannot develop a brand new fact sheet. So there are 3 ways that you do that. One is translation, then there's transcreation, and then there's adaptation. And I'm going to walk you through these 3. Translation really is focused on the words on the page. It is just transferring whatever words you have on the page in English into its equivalent in Spanish or whatever other language you might be working with. You aren't really focused on taking into account any cultural nuances. You're literally just making sure that that piece is in another language. An example of this would be, you have a fact sheet, a heart disease fact sheet that focuses on eating better. And I'm going to use this as an example throughout, right? So the fact sheet on heart disease, focusing on eating better, you translate the fact sheet. That means you keep the images, you keep whatever you have on that fact sheet the same, and you're just changing the words into, let's say, Spanish. When you transcreate, maybe something many have heard, because that is something that has been used now more frequently than in years past. You take it a step further. So you actually rewrite the original text or the original material in a way that your audience will understand and connect to, but you still maintain the original purpose of that material. So you're still focused on the messenger. You're still focused on the message that you're trying to deliver, and not necessarily the audience per se. So transcreation can be okay. It's not bad, right? An example would be, we take that same fact sheet on heart disease and eating better, and you not only use the new language, right? But now you change the recipes that are being used as examples, right? You change them. If it's a Spanish speaking population, let's say it's Dominicans. I'm using me as an example. It's for Dominicans in New York. and you want to get this fact sheet out there. Maybe the recipes, you now change them into how do you make healthier rice and beans and plantains. Not that you can make healthy plantains because I feel like they're healthy anyways, but that might be biased. And then you change some of the images, right? You change some of the images so that it better reflects the audience. You're still keeping your original intent of that fact sheet. Our team prefers to use adaptation whenever we can. And adaptation takes it even a step further, which then when you're adapting, you're saying, look, this particular audience needs a completely different message. It's a message that needs to be nuanced with the unique journey of that audience. And so if we use the same fact sheet example of heart disease and eating better, perhaps the audience you're trying to reach already knows how to eat better. It's not a question of whether or not to eat better, but maybe what they need is something on how do you eat better with others, because culturally, in their culture, and I'm making this up, in their culture, they always eat in groups. And so if you're trying to take care of your health, how do you eat in a group setting and still eat healthier? Again, making this up. And so now you're sort of rewriting that fact sheet to accurately reflect the cultural nuance that keeps that particular audience from taking that health step that you want them to take. But at the end of the day, whether you are translating, whether you're transcreating, whether you're adapting, we want to make sure that you are using plain language all the time. And so I'm going to switch it over to Imani, who will give us more info on plain language.
Thank you. So plain language is a communication your audience can understand the first time they read it or hear it. All materials should be in plain language. It is the best practice you can use when creating anything. A material is considered to be plain language if your audience can find what they need, understand what they find the first time they read it or hear it, and use what they found to meet their needs. So for example, if I am looking on information on how to give my child Tylenol, this was like the hardest thing to do when he was first born. I wanted to just read the bottle and it'd be like, if they're this, then do this. And it was just confusing. But when my doctor broke down that information in plain language, she said, hey, he can have 0.25 milliliters every 2 hours. And she told me the information, she put it in a fact sheet or something like that for me, and then I could understand it, and it was in plain language, and I really appreciated that. So when you are using plain language, you are avoiding using jargons or complicated terms. You are focusing on what the audience needs to know versus what's nice to know. On the back of the Tylenol bottle, there is a whole lot of nice to know stuff, but it's not something I need when I'm trying to feed, when I'm trying to give medicine to a crying baby. And then you also want to begin your messages with a call to action so that your audience knows, like, this is what I need to do. This is the most important thing for me to do. Breaking down plain language a step further, we know that plain language is easy to understand, but it's not dumbing things down. Excuse me, when you are using plain language, you want to see who's in the room or who you're making the materials for. If you are making the materials for physicians, you can keep those materials easy to understand without like completely dumbing down the materials. And that's also what I mean when I say it's tailored to the audience's reading level, but not patronizing. Plain language is accurate, not simplistic, and it is engaging to read, but not boring. And so we're going to play a little game. You can drop your answers in the chat, but we are going to play jargon versus plain language. So I'm going to give everyone about 10 seconds to answer these because I know we are coming up on our time. So the jargon word we're going to start off with is adverse health effect. You can drop it in the chat. What do you think a plain language word can be for adverse health effect? Yep. Side effect. Thank you, Sherry. Yep. These are all great. One phrase or two phrases that we like to use for adverse health effect is bad side effect or a bad reaction. The next word, antivirus medicine. Any plain language? You can also come off of mute if it's easier for you. Vaccine. So for antivirus medicine, we have medicine that fights viruses like the flu. That's a plain language way to say that. Yep, like a shot, prevention. All good stuff. The next one we have is benign. What's a plain language way to say benign? Not deadly. That's a good one. So our answer, not a danger, not harmful or easily treated. When, yeah, good news. When something is benign, we try to we want to communicate that it is not harmful at the moment. Next is chronic health condition. Another plain language friendly way to say chronic health condition. Anyone want to take a stab at this? An illness, long-term illness, those are all good ones. One way is a constant health problem. Chronic health conditions are something that keep occurring, constant health problem. And finally, community immunity. We heard this a lot when the COVID-19 vaccine first came out. Does anyone have a plain language way to say community immunity? So I see everyone is free of. That makes sense. So like everyone is free of whatever you're trying to stay immune from, right? What we have is the protection people who aren't vaccinated get when most other people in their community are vaccinated. So if enough people are vaccinated, you are more likely to be immune to whatever is going on. So that is our little plain language jargon game. Another thing that I wanted to bring up around plain language are the plain language resources offered everywhere. But plain language is a standard for the government. Any government website, any government resource is supposed to be in plain language. And so I've shared 4 resources. These resources will also be included in our recap sheet, but there are things like the CDC plain language thesaurus for health communication. This breaks down, you can search a word that you might find complicated and it'll give you a breakdown of what a plain language word for it could be. CDC also has this cool tool that's pictured up here. It's the CDC Everyday Words for Public Health Communication. You type in a word like anxiety and it gives you some plain language words. It tells you an original sentence. So for example, the CDC original sentence was, someone who is depressed has feelings of sadness or anxiety that last for weeks at a time. But the plain language sentence is, someone who is depressed feels sad, worried, or fearful for weeks at a time. CMS has a toolkit. CMS is the Center for Medicaid and Medicare Services, and they have a toolkit for making written materials clear and effective. And then this last one, CDC's Health Equity Guiding Principles for Inclusive Communication, makes sure that the materials that you are making are health equitable. Make sure that you are calling people by their preferred names. So a big thing within this health equity guide is the way you refer to certain groups of people, you're supposed to use people first language. And so you wouldn't say the disabled person, you'd say the person with disabilities. And so that's why within our IDD population, we always refer to them as African Americans with an IDD, because they have that, they are not that, if that makes sense. And then our last big thing that you should do when creating materials is use images that appropriately represent your audience. You want to make sure that you are using diverse and culturally relevant images, and these images include depending on who your audience is, but if you're doing like an African American general population, these images should include like your younger, older, able-bodied, and people with disabilities. Have a range of diverse images that reflect your audience's reality. You want to make sure your materials are geographically appropriate. And by this, I mean, no one from Miami is going to understand a New York snowstorm. And so having an image with snow in the background, they're going to be like, what? So making sure your images are geographically appropriate is ideal. And you don't want to perpetuate stereotypes. And we'll get into this a bit within my next slide example. And so here we have our community health worker toolkit images. All of these images within our CHW toolkit are stock images. And to give a little background, we interviewed community health workers to see what their needs were. And we found out that they needed materials and resources on COVID-19 to effectively engage and teach the constituents of their community. And these materials needed to be culturally competent, easy to understand, and in formats that CHWs could just grab and go when working with their community. And so we came up with a bunch of different fact sheets, palm cards, flyers, and frequently asked questions materials. And so pictured on the slide are a few, beginning with the top. This says, know the symptoms, stop the spread. It was I believe this one was a general palm card. This stock image, we made sure to include a darker skinned Latino because we wanted to show that we knew that there were very diverse Hispanic Latinos or Afro-Latinos within the communities that the CHWs were working in. And the second image on the bottom right-hand corner with the pregnant belly, we added a wedding band because the original stock image didn't have one, and we wanted to show that, this pregnant woman is married. And then finally, for this last image, and in general, the other two, we wanted to make sure that the background that we used was realistic for the intended audience. So in this last third one, you can see there's a city scene background, and that's where a lot of our community health workers were working. And so that's what made sense.
No, I also wanted to add, when you work with stock photography, which, is the most cost-effective way, right? No one has budget to do full-blown photo shoots all the time. And so, you have to really dig deep into those stock photo galleries for pictures that depict the audience that you're trying to reach most accurately. I think Imani mentioned, the background being important. We went through and these are community health workers, right, that are in communities that the ones that we were particularly working with are in very low income, some rural settings, some in urban settings. So we had sort of the range. a lot of the stock photography was, you know, folks in very fancy looking living rooms. And so we're like, yeah, you know, that's not going to work. And so we wanted to make sure, to Imani's point, that, you know, we did our due diligence in looking very hard and very close at each image that we chose. Sorry, Imani, for.
No, you're fine. But that honestly brings us to our end, our recap. So Cassandra, I'm passing this back to you. You're muted.
There we go. Sorry. So thank you all for joining us. You can go ahead to the next slide. If you have your smartphones out, you can go ahead and get use the QR code to download this slide, as well as the resources that Imani mentioned for plain language. At the end of the day, we want to make sure that we're not cutting corners, that we're doing our due diligence and research so that we understand our audience, that we make sure we understand whether or not we need to segment, that we leverage the partners that make sense, that we let the audience insights always guide the work that we're doing, that we use the language that our audiences prefer, and very importantly, that we use plain language, especially with health issues that are hard to understand. And at the end, that representation really matters, that, you know, we often think, you know, it doesn't, but it really does. And so those images are important, and making sure that we have good ones. And so thank you all for joining. I know we have like 15 minutes left. Our contact information is there should you want to reach out, but we are happy to take any questions you may have. No questions? Thank you all. Well, thank you, Jennifer. Thank you, everyone, for attending. This has been a pleasure. We hope we didn't bog you down with too many activities. So thank you for participating and indulging us. Oh, thank you, Wilbert. That's awesome. You just made our day.
Yeah.
Thank you,
Thank you
Shanika.
guys so much for joining this session. You guys can navigate back to the agenda once you guys wrap up here. And just by clicking the link I dropped in the chat, so you know where to go. Feel free to chat for a little bit still, but next sessions will start in about 15 minutes.
Great. We'll hang out in case anyone has a question that pops up, or oh, I'm discussing media channels you use for submitting the information you have. Yes.
Yeah,
Do you want to answer it, or do you want me to answer?
you can answer.
Yeah, no, we definitely do take into consideration the group and what is their preferred channel. With the migrant workers, for example, we did not, for most of the other audiences, we did social media posts. With the migrant workers, we learned that they are much more bigger users of WhatsApp. And so with that particular audience, we did actual WhatsApp GIFs instead of social media posts, because we knew that that would be the best way that they would for sure disseminate the information.
That was a good question.
Yeah, that was a very good question. Yep. You're absolutely right. And you know what, Johnny? You know, those are insights that we learned also from asking both in focus groups, but also the partners that we worked with. We specifically asked, you know, what has worked and what hasn't, and what should we dedicate time and resource developing versus not. You know, we did partner with organizations that were already organizing within that community. And so we were able to leverage some of their insights in what they did in the past. And so that was also helpful. Yep. Yeah. Thank you, Charles. Johnny, that is, that's a great point you bring up. One of the things that we also ask that is part of that audience piece is who is the intended audience, right? And looking at, for example, the whole second generation and the first generation piece. Sometimes the intended audience may be the mother, right? But let's say the mother is a first gen immigrant to the US. The materials sometimes may need to be developed in a way that the 10-year-old might be able to read and be able to relate the information to the parent, because they are that gatekeeper of information. And so it is, to your point, very important to acknowledge that as well.
Yeah.
That we do have that as well.
We've noticed that a lot actually with our Haitian audience, that the people who they're like, the audience might be for adults in general, but the people who they trust the information from is usually the children of the parents. And so having that like younger focus, and that we can relay those, having those younger audiences be messengers for our older audience is really helpful.